Welcome to the HealthChangers podcast presented by Cambia Health Solutions, where we share real stories of healthcare transformation from those experiencing it and those helping to make healthcare more personalized. I'm your host, Leslie. This episode is part of a special series of mini episodes highlighting our nation's caregivers in partnership with Archangels, a national movement recognizing and honoring caregivers. Until recently, there were 44 million caregivers in the United States. Now, in the midst of a global pandemic, we are all caregivers. Caregivers include medical teams, grocery workers, truck drivers, and others, working to find balance, trying to perform at work, while all at the same time not jeopardizing the care provided to their loved ones. For this special episode of HealthChangers, we hear a personal story from Dr. Ranak Trivedi from Stanford and a Sojourns Scholar, and Peggy Maguire from the Cambia Health Foundation.
Well, thank you, Leslie. This is Peggy, and I'm delighted to be here today to interview just a phenomenal human being and a Sojourns Scholar. So tell us about your project.
Yes, thank you, Peggy, and thank you, Leslie, for inviting me so I can share my project and my experiences. So I was actually born in the U.S. but grew up in India. So all my life I have straddled both the cultures of being South Asian, specifically from India, as well as then when I moved back to the U.S. when I was just shy of 21, continuing to live in the United States. And my interest in caregiving specifically was a convergence of my clinical experience, my research experience, and my personal experience. I was already focused on the mental health aspects of chronic and serious health conditions like heart failure. And clinically, I was treating people in inpatient settings on trauma units and other medical units, and noticing how families were so integral to the process of care, but also noticing that we were not really checking in with them or giving them the resources that they might need to navigate both the inpatient stay as well as the discharge process. So this kind of got me thinking as to my next research dimension as I finished my PhD, to think maybe I need to focus on families. And then I just happened to be home visiting my parents, and my dad has chronic heart disease issues, and my mom has at that point was dealing with breast cancer. She continues to be treated for metastatic breast cancer. And I noticed how they were both helping each other remember their medications and make sure their treatments. And I had this aha moment of realizing that we tend to focus very exclusively on patients, but patients are working within their family systems, their social systems to navigate all kinds of different self-care activities, whether it's taking care of their medications or following diet recommendations or exercise or what have you. So this has gotten me to thinking over the last some years on caregiving, specific to the Sojourns project that I'm very excited about, is I get to focus on South Asian women with breast cancer and their caregivers, or their family, as I like to call them, friends and family. This, of course, as I noted, my mom has metastatic breast cancer and has been managing cancer for over 18 years at this time. And we as a family have always stepped in, and I get to now do a project that focuses on people like us, people like me. In psychology, we often say research is me-search, and so this is a perfect example. So what my project is going to be is we are going to talk with South Asian women with breast cancer at Stanford and their family, as well as those in the community, and understand what their unmet needs are, both emotional as well as home and community-based services, and then use that to develop some intervention that can help bridge that gap.
That's great. I think the observation I had in listening to you is that I think the most powerful work and inspired work is work that comes from the heart and comes from a true place of inquiry and wanting to improve the care and the quality of life of the people that you love, but then also extend that learning to systemic change. So thank you for your passion and for applying a professional lens to your personal experience. I also love that what you said about, our system traditionally has focused only on the patient, and we're learning that patients do work within family systems, and that caring for the family system is integrally important to the patient, but also to the caregivers. So I'm just delighted that you're doing this research, and I think that it will have a great impact on the way people and families experience care in the future. I want to shift a little bit to the recent days. I think as a country and actually around the world, we're dealing with this pandemic, and it's really unprecedented in terms of the level of suffering that we're seeing in the U.S. I wanted to ask you, in light of COVID, what challenges have you seen for caregivers over the last 5 to 6 months?
Yeah, this has been a really trying time for caregivers. So we know that in the U.S., a report just came out from National Alliance of Caregiving and AARP that the survey predates the pandemic, and 53 million caregivers, adults are caregivers in the U.S. That number has certainly gone up since the pandemic. There's no question. We don't have numbers, but there is no question that people who were not formerly caregivers are now thrust into caregiver roles. And caregivers who were already providing care are now potentially adding multiple caring roles because kids are now home, or they're taking on more healthcare responsibilities for a wider network of people, even as they're balancing their own personal needs and professional needs and jobs and so forth. Few of the key things that have been really topmost on caregivers' minds and policymakers' minds is these issues around visiting in nursing homes or in healthcare settings, or caregivers accompanying patients to the hospitals for even different visits. So, for example, when people are typically not currently allowed to accompany a patient to their visits if they're in person, because because of shelter in place. Unfortunately, the question that often gets asked is, are you a visitor? And so people say yes, and so they're excluded. But the problem is caregivers are a lot more than just visitors. They are essential to the healthcare process. They're advocates for the patients. They're often translators and interpreters of the information for people who have different language barriers. So they play a myriad of roles that are currently not being played by anybody in this context. The other issue is, as we're moving more to virtual care, it's not clear how frequently caregivers are getting involved in the virtual visits. On the one hand, you can imagine that there's a greater opportunity for caregiver involvement because the patient is home and often on video, and the caregiver can drop in. However, it's possible that clinicians are more nervous about the HIPAA violations in doing so, and so caregivers may feel more excluded, especially if it's a telephone call. So these are some of the challenges that I think that the pandemic has caused broadly, as well as it's specific in the healthcare settings. This does not even touch on things like childcare responsibilities that often caregivers have also that are not health related, but just other vulnerable people they're caring for.
That's a really interesting perspective, and I think caregivers sound more like essential workers than visitors, if you think about it in those terms.
And in fact, in UK, they passed early on during the pandemic, and I forget, I want to say in March or April, the caregiving groups did effectively lobby to be called essential workers so they could get COVID testing done as frequently and as quickly as the essential healthcare workers were able to get done. So there are countries that have declared caregivers specifically as essential workers in that very sense, and therefore give access to resources that essential healthcare workers also have.
Very interesting, and potentially a path forward for us on the policy perspective here.
Mm-hmm.
Let me switch gears a little bit and ask you about the caregiver survey that you and your team did at Stanford to gain a better understanding of the experiences of caregivers during the pandemic and what their responses revealed. What are some of your early observations?
Yeah, and this is actually an ongoing survey. As the pandemic continues, we are keeping the survey live. It's an anonymous survey, and it's it's available through social media, and so therefore anybody across the world can participate. And the impetus was exactly this, is that we could speculate that caregivers' lives are very different from the pre-pandemic era, but we don't know how. And so we thought we would field a survey that is certainly not going to be representative because it's anonymous and we're not targeting specific groups of people, but really to just get more of a flavor of what it might be like to be a caregiver during this time. That's all we wanted to capture. So we fielded this survey early on, kind of late March or early April, and we have last about 300 odd responses. Like I said, we're still collecting responses. And we've just started looking at some of the data. So some of our kind of interesting findings that we're starting to see is, not surprisingly, people are sharing that they are taking on more caregiver responsibilities, and that those caregiver responsibilities are often for adults. And so it's not just additional childcare responsibilities, but actually other adults in their network who also require healthcare related caregiving. The other things that people are reporting are that they're very anxious to leave the house, not just because they're afraid they will get COVID, but that they're afraid that their care recipient will get COVID. Mm-hmm. They're taking a lot of additional precautions, like PPEs or disinfecting surface, a lot more than they used to. Some of the kind of uplifts that we also wanted to capture, there's this sort of tendency of talking about caregiving and it's always in this kind of negative, burdensome terms. But obviously we know that there are uplifts to caregiving and we wanted to capture that. And people are reporting, and this is very preliminary, that, in some cases actually caregiving has improved because nobody's going anywhere and the person is at home and they're home, and so they can care for their care recipient much more easily, and so the pressure is off of juggling commutes and things like that along with the caregiving responsibilities. People are not reporting high levels of social isolation, which was a surprise to us, but people are reporting higher anxiety overall, higher depressive symptoms. When I say higher, I don't mean compared to how they used to be, but just higher on the scale that we use to measure it. And generally people are really feeling like their lives are quite different since the pandemic started. What will be interesting for us to look at as the responses continue to roll in is to see if different waves of COVID affected their responses. And we're trying to link it with different state level shelter-in-place shutdowns to see if that has any influence in how people are reporting their well-being as well. Because we know different states enacted these shutdowns at different paces and different times.
Right, and then the wearing masks. I mean, I think here in Oregon we talk about three things, 3 W's, if you will. Mm-hmm. Watching your distance, right? Mm-hmm. Washing your hands, and then wearing a mask.
Yeah.
And those are 3 things we can all do to keep each other safe. But yeah, the thought that caregivers are concerned about passing COVID to the one they're caring for is probably, I can imagine that's just a real source of anxiety. But I do love that you identified some uplifts for caregiving as well, in terms of less stress if you're not commuting and, spending more time in the home. What are some of the systemic inequities and barriers that caregivers face?
This is a topic that is so dear to my heart that you're asking about, Peggy. Our healthcare systems, and you mentioned this too, are very designed with the sort of, it's what I would say a Eurocentric view, where you have a nuclear family, you have, often it's a heteronormative family we have in mind, and it's designed to think that patients are going to take care of themselves. However, we know that's not true for anybody. But what we get into is, with the systemic issues, is cultural perceptions of what caregiving looks like. So, for instance, we talked about the uplifts and the negatives, and there's been good work showing that African American caregivers actually don't experience distress to the same extent as white caregivers of dementia patients. And so it's not necessary that being a caregiver is associated with negative outcomes. And different cultures take caregiving differently. So we, in the healthcare system, kind of assume that if you will have a partner with you, that person is the next of kin and the default caregiver. But I can say from my experience of watching my mother's care get distributed and other people in the South Asian culture, is that it's often other women within the network who actually step up. Somebody drops off meals, somebody comes and gives company, somebody helps with the child care as the woman with breast cancer is recovering from whatever procedure or treatment she has. These factors are really important in the health outcomes, but are not coded at all in the way we deliver care, because it's very patient focused. We also assume that all the decisions are made by the patients, but I can tell you in a lot of cultures, including my own, especially among more Orthodox families, it's the patriarch who makes a decision. And the patriarch might be the woman's father-in-law. It may not even be the husband. So there's a lot of ways care gets distributed that does not get captured. If I can share a story of how ill-designed our healthcare systems are for this. Years ago, my dad had to get an emergency bypass surgery, and it just so happened coincidentally that one of his closest friends was getting surgery for another disease in the same hospital at the same time. And they've been friends for now 50, 60 years, and at that time about 40 years, so they have the same friend circle. And I was doing my PhD and I flew in, but they were all in Chicago, and I entered the waiting room. My dad and his friend were both in surgery, and the waiting room was full of our families and our friends. And it was like a party in there because there was just so many people. Somebody had tea, somebody had snacks. We had taken over the entire waiting room. And so, of course, other patients' families unfortunately did not get enough space, but it really helped my mom and a friend's wife get through several hours of uncertainty of knowing what's going to happen. How do we encode that kind of strong social network, which we know is so critical? How do we encode that in our building design, in our healthcare delivery, in our clinical contact? And these are the barriers that people of different cultures experience.
Yeah, I thank you for sharing that story. I love that story, and I love the frame of the distribution of caregiving duties across a network of community members. And I think that really does challenge us to think about caregiving in a different way. You know, we do tend to think in that the stereotypical view is a caregiving is a white middle-aged woman caring for a parent or perhaps a spouse. Mm-hmm. But as you started to tell that story, I was thinking about, at the beginning you told about both of your parents had health issues, and I was thinking about how do they care for each other, and then you expanded that even more to how do they care for each other within a community of distributed duties and resources. So I think continuing to challenge ourselves and our biases, I'll say, to think about what is really necessary to improve the care of the patient and the quality of life of the traditional caregiver. So thank you for sharing that story.
And another dimension to that, if I may add to that too, is, like you said, we often think of intergenerational care or partner care. But for example, if we look at caregiving, how it occurs in the LGBTQ plus community, there's a lot of peer care because there's a lot of the intergenerational aspect is quite little. A lot of times they don't have strong ties with their families of origin. And a lot of times they don't have children of their own. And they often wind up providing care to friends they might have, and they may not have partners. So again, that's a different cultural dimension that is really important for us to be thinking about when you think of caregiving, is that knowing and being really thoughtful about who the caregivers are and what roles they play would be a really great step forward for how we deliver healthcare in this country.
Yeah, thank you. You can't see me, but I'm sitting in my chair and I'm nodding so hard that I'm almost rocking. So that's where I love your, the word that you taught me of family, right? That it's the family that you create and the network of people that love you and, support you and support each other. So, as we often say, love is love, and family is how you define it. And we need to recognize that within our healthcare system to achieve the best patient outcomes. What about the current revenue model? How does the way that we pay for care impacts the patient and caregiver experience?
Yeah, this is such a great question and also something that does not get enough attention. The challenge is that there are a lot of clinicians actually want to engage the family, the caregivers, the friends, but there's not really good reimbursement models right now. And so in fee-for-service systems like we have in the United States, what happens is that the clinicians have to prioritize doing a clinical contact or something that continues to maintain the revenue stream to the detriment of engaging in family conversations or other things that are either do not produce revenue or produce revenue at a lower rate. So an important policy shift that we need to consider as we think of changing the healthcare delivery is actually at even creating codes that would allow clinicians to bill for caregiving contact, because that then both incentivizes the clinicians to engage and also puts it well within their scope of practice. And so they don't feel that they're going beyond their scope of practice to engage with family member when they can bill for that.
That's great. It's funny because we've been talking about moving to more value-based models to improve the patient experience and outcomes. And we've been steadily doing that with our health plan business. but I hadn't specifically tied these more innovative value-based models to improving the caregiver experience. That helps me to think about it in a new way. So thank you.
Oh, good.
I feel like I could talk to you all day, but our time is running short here. And I think one of the takeaways, you've said so many really interesting and important things here, but one of the things I'll take away from this is that we need to recognize that patients are working within family systems, and there are unique cultural differences and norms that need to be acknowledged and incorporated into the care delivery model as a way of reducing, if you will, any injustice in the delivery of healthcare.
Absolutely.
Well, I really appreciate your time today. More importantly, I appreciate the work that you're doing and the research that is shedding a light on the issues that caregivers face in our healthcare system and in our society. And your work is really important, and I hope that it continues to go well and that you will continue to share your wisdom with us and the world as we learn to better incorporate caregivers into the care experience. Thank you, Ranak.
Thank you so much, Peggy.
Before we wrap up this special episode on caregiving in a COVID-19 world, we asked Alex Drain, the co-founder of HealthChangers, a national movement to recognize and honor caregivers, to share a little reflection on what she heard.
Peggy and Ranak, I loved this. Peggy, you know I love every single one you do. I love being a part of this. Thank you, thank you, thank you. HealthChangers is so deeply honored. We're so grateful to be able to hear these stories and share these stories. And then Ranak, you're a Sojourns Scholar. It's one of the things I love about Cambia is this program, this incredible unparalleled program they put together to find you gorgeous bright spots and find ways to scale you and make sustainable the insights and innovations and love that you're bringing out to the world. So my great pleasure listening to you both. Thank you. That was freaking awesome. And just a couple quick thoughts. One, I think we hear a lot about these newly practicing doctors who, as they get started, get this sense that they're missing something. And you articulated so beautifully what I wish the whole country, the whole world would, well, let's just stay with the US for right now, would come to understand, which is one of the biggest missing ingredients in clinical practice asked to find today, is a recognition, a broadening of the definition of who is doing the care to include that unpaid, informal, often family caregiver. And I love when you thought back on your own life after you had this aha moment and realized, seeing your own parents and the role that they played for each other. We often use the term look as part of look, love, lift. Wherever you are, look around you, there are caregivers everywhere, and they don't look necessarily like you would expect. And once you see them, you can't unsee them. But I think there are also some things that came out throughout the course of this podcast that we see all the time. There are aspects of care that are universally the same. Care on some level is care. We like to say at HealthChangers, all care counts. It's just often folks don't consider what they're doing to be caregiving. It's just being a neighbor, being a friend. The image of that crowded waiting room will stay with me for a long time. That's so beautiful. In that case, the caregiver was the community. And there is a communal aspect to caregiving. In many cases, being a caregiver is a shared job, and that can make it harder for individuals to self-identify, or even more importantly, for us as a community to see them in the role that they're doing. There was a meeting that I was in once where a CFO of a major company came to the meeting. It was about caregiving, self-identifying in the beginning as not being a caregiver. And over the course of the meeting, she identified her sister as the caregiver in their family. And she said, well, because my sister takes, our mom to the doctor's appointments. And over the course of the meeting, she came to this broader definition in her own mind. She realized, oh my gosh, all care counts. In fact, she spends 10 to 15 hours a week doing her mom's finances. And she realized, well, that's being a caregiver too. And that's true. There's a legal aspect, there's an administrative aspect, there's often a who's administering the medication perspective, who's taking someone to the doctor perspective. And because this role is so intense, it often has to be shared. And because this role is so intense, if someone's lucky enough to be able to share it, and because this role is so intense, often somebody has to quit. And because you really can't do two jobs at once, right? You physically can't. And what I appreciate so much about where the world is going, and specifically, extraordinary employers like a Cambia or a health plan like a Cambia, in both of those roles, are realizing that if we can give those caregivers that support, they don't have to quit. And there is a genuine ROI. I'm happy to run through the numbers with anyone. There is a genuine ROI, clear, measurable top and bottom line impact to being able to keep these essential workers, because caregivers are essential in their home, but they're also essential in your workplace, in your health plans, because they are multitaskers. They know how to get this stuff done, right? They play all these roles, lawyers, translators, advocates, all of these. They are multitaskers extraordinaire. We love to say, hire a caregiver because they will be able to get stuff done for you. The notion around this point about essential workers, I love that part of the podcast as well. It's one of the reasons why we use the term archangel, because the term caregiver has a lot of confusion around it. Are you a paid caregiver, unpaid caregiver? It's often associated with a female role. We chose the name archangels very intentionally because an archangel is a warrior angel. You get this vision of this person who comes in and they have fierce and the advocacy of this person that they love, right? They spread their wings big and broad and wide over to make sure that this person is cared for, is protected, gets what they need, gets what they should. And I love that aspect of, don't presume you know who a caregiver is because you don't. So thank you guys. This is beautiful. And I'll look forward to being able to share this with people so that they can see both the specificity of this particular South Asian woman with breast cancer caregiving population, but also the universality of being a caregiver, because we are so much more alike than we are different.
That wraps up this episode of Health Changers. You can find more information on all of our episodes at cambiahealth.com. You can also follow us on Twitter at Cambia, CAMBIA. For more information on Archangels, check out their website at archangels.me or follow them on Twitter at archangelsme. You can now find Health Changers on all of your favorite platforms. Just search for Health Changers on platforms like Apple Podcasts, Spotify, and iHeartRadio. Also, subscribe and leave a review. Thank you for listening.